In this video, we'll discuss about bioavailability. What is bioavailability? This is drugs. The drugs is going to inside and getting absorbed. Acidic drugs from acidic medium, basic drugs from basic medium. Ultimately, the drugs reaches in the circulation. So if I have given 100 gram of drugs orally, how much gram is reaching to that circulation? Maybe in the circulation only 70 gram or 80 or 90 gram is reaching, but it is never 100 by a oral route. Oral route is never 100 percentage. You are giving, it is not 100 percentage observed. Whatever you are giving, it is not 100 percentage observed. So that is bioavailability. Bioavailability is the percentage of administered doses. Whatever dose you are giving in the administration, what percentage is reaching the circulation, that is bioavailability of the drugs. So what percentage is reaching the circulation, that is bioavailability of the drugs. So what is bioavailability? It is how we will define that bioavailability. It is the percentage of fraction of that administered dose, whatever dose you are administrating in the patient. It is a fraction of that reaches the circulation in unchanged form, that reaches the circulation in unchanged form. Again, start from beginning. The patient is taking the drug from mouth. It is going inside before going these blood vessels. Okay, in the blood, the intestine here, intestine drainage. From that intestine, there is a portal vein. From the intestine, there is a portal vein. The portal vein which goes to that liver. The portal vein which goes to that liver. From a liver, it will go to the heart. Okay, it will go to that right side of that heart. From that right side of the heart, it will go for that purification. Okay, it will go for the purification here in the lungs. From the lungs, it will go to that left side. So it will go to the left side of the heart. From the left side of the heart, it will come through aorta. It will come through aorta. Okay, aortic wall. Then it come into that blood vessels, blood. This is aorta. This is the circulation. So it is coming to that aorta via liver. Here this liver containing some enzyme. Enzyme is present at sometimes enzyme. Okay. Why 100% drugs not reaching into that circulation? Whatever percentage of drugs you are giving, for example, I am giving 100%, never 100% which reach here, never maybe 99%, never 100%. It can be less than 100 via oral route. Why it is less than 100%? Because of two main reasons. Because of two main reasons that 100% not reach. First reason, is the absorption. That absorption is not complete. Sometimes it not completely absorbed. Whatever dose you are giving, absorption may problem. Sometimes there is disease in the stomach. Sometimes the stomach is full with food. Sometimes some inhibitors are presented in the food, so absorption is not complete. So the first reason, it is absorption is not complete, and whatever is observed, it is going to liver via portal circulation in the liver containing a certain enzyme. Okay, that enzyme are there that will deactive the drugs. So that enzyme deactive the drugs. The remaining portion which is coming, that is the drugs, actually will show its site of action, it mechanism of that mechanism on the site of action. So that is going to be so its mechanism of action. That because of two reason only, these drugs, okay, not 100% reached. One is incomplete absorption, second one is the deactive, that enzyme, liver having enzyme, so deactive the drugs by that enzyme. So that bioavailability reduced because of two causes. What are the two reasons? One is absorption is not complete. Second one is first to pass metabolism. First to pass metabolism. First to pass metabolism in the liver. Okay, so drugs from stomach or intestine first go to liver, then it go to heart, and then come into that circulation. So in the liver, okay, in the liver, the enzyme is going degradation of the drugs, okay, degradation of the drugs. So that is the drugs will be inactive, that portion of the drugs will be inactive. So I am giving 100 gram of the drugs. Out of 100, only 80 percentage observed here. Only 80 percentage observed here. Reach here. Now this 80 percentage will go to liver. Okay, it will go to liver. Further here 10 percentage. 10 percentage is degraded, their enzyme is presented, so degraded 10 percentage. So 70 percentage only come to that circulation, so come back, 70 percentage only come back. So out of 100 only 70 percentage is coming, 20 is lost. Okay, 20 percentage is loss in absorption and 10 percentage loss in portal circulation. So this is known as first pass metabolism. 100 percentage we are giving, only 80 percentage observed. In this one, when it will reach to liver, here enzyme degradation 10 percentage, so totally 30 percentage is missing, only 70 percentage only reaching to again reaching here blood. Whatever after that it is reaching the circulation, ultimately that is bioavailability. The percentage may be vary, so it is not oral route. Now always we given the drugs, we give the drugs by various route. So 100 percentage bioavailability occur in only one route, that one is intravenous. IV route only 100 percentage bioavailability occur. we give the drugs by various route. So 100% bioavailability occur only intravenous. If I am giving the drugs directly in the blood IV, there is a vein here, so if I am giving directly intravenous or intraarterial directly in the blood, if I am directly giving an IV, so 100 percentage I am having 100 gram by whatever else route I am giving, it is never 100. So 100 percentage bioavailability occur only in intravenous, unchanged without loss and absorption without loss in first pass metabolism. So that screenshot notes is there. What are the way? What are the different route we are giving the drugs? Then how to calculate that bioavailability? There is a way. Suppose I have a drug. This one is the drug A. I am giving an experiment. Can you please find out that bioavailability of the drugs in human? If I give the drugs to any human via oral route, okay, any human via oral route, how to calculate that bioavailability? So we have easy way to calculate that bioavailability. Okay, calculate to make a graph between two things, that x-axis, okay, two things, x-axis and y-axis in a graph. In a graph, x-axis, I have taken a tablet by oral route. It will go inside. Inside it will get absorbed and it will reach the blood. So the concentration in the blood, it will increase gradually. On x-axis takes the time, and y-axis take that plasma concentration of the drugs in the plasma in the blood. Okay, plasma means in the blood. So as the time increases, 1 hour, 2 hour, 3 hour, 4 hour, like that, so in my blood it is getting absorbed. In my blood the concentration increase. Here blood concentration increase. One time will come, it is the maximum absorbed. Okay, this one, at that one point of time, here maximum absorption, maximum observed. So this is the maximum plasma concentration. After that it will show its mechanism of action and get excreted in urine. Then its concentration fall, then it reach to zero, already starting zero. Then the result become fall. Okay, the concentration of the plasma fall, then it reach zero. So this graph is plasma concentration versus time. Plasma concentration versus time. If you take the area of this graph, this one is the area, this one is the area of that graph. It is looking like a triangle. It is looking like a triangle. You know what is the formula of triangle? Area is half into base into height. X-axis time, y-axis plasma concentration. Time increases 1 or 2 or 3 hour. Plasma concentration also up to that maximum it will reach after some particular period of time is decreases. So this one look like a triangle. What is the triangle formula? Half into base into height. So a bioavailability is the area under curve. AUC, area under curve. It is known as AUC. What is area under curve? Which curve? The curve is between two things, plasma concentration and time. So make a graph. What you have to do, you have to make a graph between the time and the plasma concentration of that particular drugs. I am having a drug A with me, so I will take a subject. There is a subject in front of me. That means patient. I will ask that subject to keep the tablet in the mouth. Take it with water. So every 1 hour or every half an hour, I will take the plasma concentration. I will take the blood sample and check the plasma concentration of the drug. So this is the time is 0, starting time is the 0. So it will check at 1 hour, 2 hour, 3 hour, 4 hour, 5 hour, 6 hour, 7 hours, like that. And the plasma concentration 10 milligram, 20, 30, 40, whatever. So I will find that gradually the plasma concentration increasing, because the drugs is observed and observed. That acidic from the stomach, basic from that intestine observed, it will reach that maximum, and then it will excrete, finally become 0. So area under this curve will give you the value of bioavailability. It is known as AUC. Area of this one name is called area AUC, area under curve. See the x-axis and see the y-axis. This is the area of that curve. This will give you the value. Now I have one drugs, again the same drug A. Okay, I having two different subject A, two boys or two patient A and B. Okay, I am having two subjects. So this subject or patient, I am giving one subject A, I will give doses orally and checking that bioavailability by making a graph. So this is the graph of A. This is the graph of A orally I given. I mean the patient, the subject which I am giving oral route A. Okay. Next, the same drugs I am giving that patient B through intravenous route. Directly I am injecting. So this is the curve. Another patient which I am giving it intravenous. So this one is orally given, this one is the intravenous. You can see now, calculate that area. This is the area and calculate this area. This one is the area which already included this one. Okay, this already included along with this one. So calculate this area. Obviously you can see the area of IV intravenous is more than oral. In intravenous is 100%. In oral it is never 100%. So this is how we can calculate. This video discussed about bioavailability. This one is the master diagram. Orally never observed 100%. Maybe 99% also possible, but never 100%. But intravenous 100% is possible because directly injected to blood. Why not 100 percentage means because of incomplete absorption and first pass metabolism. Because liver having some enzyme it is degraded. X-axis time, y-axis plasma concentration. Once it reached maximum, after that it decreasing, it looked like a triangle. So what is the formula of triangle? Half into base into height. This one is the two sample A, sample B. Sample A injected orally, sample B injected intravenously. This one 100 percentage absorption, this one never reached 100 percentage. This is all about bioavailability. Thanks for watching.